Okay, good evening. This is Brother Wolf, and this is HS 285. Tonight's group is Group 7. They're going to tell us a little bit about a very important segment of the healthcare industry, how the federal government is involved in healthcare in America. And so their topic is HHS, or the Department of Health and Human Services. And Susie is going to start, and whenever you're ready, Susie, feel free to begin.
Okay, so like you said, we're doing the U.S. Department of Health and Human Services. The first topic that we needed to talk about was the organizational structure. So this is just their regular seal. You can see it on the left side. That's just what they use. And then they have their slogan, that's improving the health, safety, and the well-being of America. Okay, next slide. So this is a chart of all of the organizational structure. So you can see at the very top they have like the secretary and the deputy secretary, and you can follow it just like you would a normal web and find out all the different jobs and things that are interconnected. Okay, go to the next one. So I kind of did a little bit of history that kind of explains a little bit more about the department. And in the history it says that it's also known as just the Department of Health, is kind of like its shorter name that people use. Before 1979, it was called the Department of Health, Education, and Welfare. And that was all established in 1953. And then when it was separated, it was changed to its current name. So some facts about it is that they have 79,000 employees to date, and their annual budget's about $1.02 trillion, and their headquarters are in Washington, D.C. And so this is like the five of the following, like their major components of the department. So there's the Office of Administrator, the Public Health Service, the Office of Education, and so on and so forth. Okay, next slide. Okay, so this graph was kind of cool. A lot of the readings talked about what an impact the department made on America and the health of its citizens. So you can see where in like 1970, where it split off and they really focused on the health, how much the deaths went down per 100,000 population on this graph. So you can see that, and it was just an interesting statistic and showing what great this department has done. Okay, next.
All right, so just to talk about some of the personalities of the HHS. So the head of the department is the secretary, and right now that is Sylvia Matthews Burwell. And so she's part of the cabinet that works with the president, and so she was nominated by President Obama and then confirmed by the Senate. And she oversees all the employees. And something interesting when I was doing my reading was that she has asked the department to operate under 3 guiding tenets, which are deliver results on a wide range of complex issues, strengthen the relationships that drive progress, and build strong teams with the talent and focus needed to deliver impact for the American people. And so basically her main job is to advise the president on matters involving health, welfare, and income security programs. And she also lets our population become aware of what she's working with, the objectives of the department. And on the website, hhs.gov, she actually, there's podcasts or blog posts of her speeches that she gives, and so we're able to know what she's working on. Next. All right, so the next one is the Deputy Secretary. His name is Bill Core. When it says that he's the Chief Operating Officer, so he works with the Secretary, and he oversees the development and approval of all HHS and significant guidance. And he leads initiatives, and so that pretty much, for example, the president's management agenda, so anything that the president wants them working on involving the health. and welfare of the country, or public health emergency preparedness. Next. All right, another important personality of the HHS is the Inspector General, who is Daniel R. Levinson, and he's the head of the Office of Inspector General of the HHS, and he's been it for over a decade, which is pretty impressive. And his roles are he leads an independent and objective organization of 1,500 auditors, evaluators, investigators, and lawyers who oversee the integrity of and efficiency of the federal health and human services. Next. And then one more person that I found really important is the Director of External Affairs, and that is Anton J. Gunn. And so he is the principal advisor for cultivating and maintaining relationships with external stakeholders for the Secretary, and he also represents the Secretary in direct official dealings with national, state, and local external organizations. So one more slide. And so that's just a list of all the jobs and offices that are included in the HHS. Next.
All right, so I'm going over the functions of the HHS. So their website says that the mission of the U.S. Department of Health and Human Services is to enhance and protect the health and well-being of all Americans. To accomplish this mission, the HHS efforts include increasing awareness of healthy lifestyle choices for Americans, providing essential human services, especially for those who are least able to help themselves, and fostering advances in medicine, public health, and social services. These are accomplished through the collaboration of 11 operating divisions. 8 belong to Public Health Service, and 3 to Human Service agencies. Some of the divisions are the ACL, I have these written down, but I can't see my notes. AHRQ, the Administration for Children and Families, I'm trying to remember what that one stands for. Administration for, I can't think of that one. But yeah, the ATSDR, the Center of Disease Control, Center for Medicaid and Medicare Services, the Food and Drug Administration, the HRSA, this one's it's for Native Americans, like health of Native Americans. The SAM, HSA, and the NIH. And the strategic goals of the HHS are basically they set these out for a 4-year, to define a 4-year mission plan, basically, to break it up a little bit more and to make sure that it's current. So their strategic plan, the agency strategic plan, defines its mission, goals, and the means by which it will measure its progress in addressing specific national problems over a 4-year period. Every 4 years, the HHS updates its strategic plan, which describes its work for addressing complex, multifaceted, and evolving health and human service issues. And the most recent one was updated on March 10th of 2014 for the 2014 to 2018 period. And these are the goals that they set in place: to strengthen healthcare, to advance scientific knowledge and innovation, advance health, safety, and well-being of American people, and ensure efficiency, transparency, accountability, and effectiveness of the health and human service programs. One of the most important of these organizations to help them accomplish, to help the HHS accomplish their goals, is the U.S. Centers for Medicare and Medicaid Services, and they play a huge role in the fulfillment of the mission by catering primarily to the poor and elderly populations and those who cannot help themselves. CMS aims to provide better care and lower costs to their beneficiaries. So yeah, they do that by just making sure that they're receiving quality, coordinated, effective, efficient care, and that drives down the costs. They also focus on prevention and population health so that all Americans are healthier and their care is less costly because they're living a healthier lifestyle. And they also focus on expanded healthcare coverage so that all Americans have access to affordable healthcare options that protect them from financial hardships. There we go.
And I did the Centers for Disease Control and Prevention, which is also called the CDC. Chantel covered it a little bit. It's one of the 11 organizations, like she said. And an interesting thing about the CDC, just like the FDA and several other organizations, they aren't here just for the U.S. They want to protect the Americans, but they're also proactive against diseases, and they go out if there's a disease in a foreign land that's gaining popularity or taking hold of people, they'll go out there and study it and try to find cures for it. Anything, and it's to prevent attacks. That's part of their mission, or what have you, spread of disease. Another thing that's part of their mission is they want to they want to keep us healthy too, just to save lives and protect people from any kind of threat to their health. And so with their mission as their purposes, which are to be on the cutting edge of health security, which was described, help medical care improve, fighting diseases before they reach us, and nurturing public health in general. Okay, next slide. Their slogan that goes with their cool little logo is CD4-7, saving lives, protecting people. And how do they plan to protect us? Well, there's several things on their site. They disclose an outbreak, like in the form of news and media articles. They give you updates on outbreaks, like how big they're getting. That's why Ebola was so well spread or so known, is because it was gaining hold of a lot of people. It was spreading really fast, and they give media updates on that, which in turn comes to us, and news articles and scientific stuff relating to the diseases and the health in general. And they also, more on the proactive side, they'll give you tips to avoid diseases if they know any, stuff like that. Okay, next slide. Here's just an example, like a current issue that they had on their site about a week ago or a week and a half ago when we were doing our research, is they were saying 23,000 people were dying from antibiotic germs, and 30 to 50% of the antibiotics that are prescribed are inappropriate to what disease or what germs that people have. And so they give you news and updates like that on actual real life issues that are happening in real time in the nation and abroad. Okay, next slide. Just thought that was cool to give you a little taste of what it's about. And then other things they do that they cover is like healthy living, travelers' health, data and statistics of diseases and what have you, and injury and violence safety. And they also had several more things, including, like Chantel was talking about, the Native American health and stuff like that. There's that one organization that's dedicated just for that. Well, in the CDC, they even have their own topic or their own branch that just describes current issues for the reservations and such. So it's really interesting. If you've never checked it out, I would recommend you check it out. It's one of the many branches of the HHS, though. So that's that. Next slide.
That's the last one.
Aw, darn. Oh, and another thing that came to mind when she was mentioning the FDA is another way the FDA helps abroad. I'm not trying to steal anybody's thunder, but it occurred to me. we do all the research to make sure the drugs are safe for human consumption, and that reduces a lot of other countries' research expenses, because then all they have to do is reverse engineer them chemically and produce their own copies, and they can get their drug at a fraction of the price that it costs us, because we're paying for the research and making sure they're healthy. So it's kind of neat how much it helps other people.
Great, thank you. So I'm assuming you guys are done?
Yeah.
Excellent job. If you leave the slides up, I want to highlight a couple of them. So I'm glad, Ross, you kind of gave us a little taste of the CDC, and that is one of the major, a lot of us have probably heard of the CDC even before you took the class, right? So it's kind of one of the more well-known departments within HHS. Some of you might not have known, and not just your group, but the class who will listen to the recording might not have known that the CDC is a part of HHS. You also mentioned the FDA. That's another very large, influential organization under HHS. You talked about CMS, and Group 8 tomorrow will present, their whole presentation is on CMS, because CMS is such a major part of the healthcare. I mean, a lot of these departments are a major part of healthcare in the United States, but CMS is the largest payer in the world, and so we've devoted a whole presentation just to CMS, because if you're in this field, or even if you're not, you probably have loved ones or others who will either have Medicare or are on Medicare or Medicaid, and so it's an important topic even if you're not going into healthcare administration. And if you are going into healthcare administration, CMS, that'll just be the beginning, tomorrow's presentation. If you would go back to the slide that had the different, go back to that CDC, the one with the virus on it.
Okay.
So the one before it. That one. That, if I'm not mistaken, that virus right there, does anyone know what that one is?
Is that Ebola?
It is Ebola. Is that right, Ross?
Yeah.
Yeah, so I think that was a really good example of the CDC. Ebola the outbreak wasn't here, right? It was in Africa. But with the way travel is nowadays, the world's getting smaller, and like you said, it was in the United States' interest to get that outbreak under control. So the United States sent people from the CDC and other organizations to Africa to try to help them get it under control. And so that's a really good example that was in the news recently. They've done similar things. So, okay, sorry. So go to, keep going. I'm not going to talk about CMS too much because I want this one right here with the icons. So the big ones that I wanted to point out, you're absolutely right, these are all important, but some of the ones that you might hear more, CDC, CMS, FDA, and then in the lower right you have the NIH. Did you guys tell us what that stands for, and what do they do? Did that come up at all?
I'm trying to. I had it written down in my notes, but I can't see my notes because I have the slides up.
Oh, sorry. So the
Sorry.
NIH, no problem. So the NIH is the National Institute of Health, and they're known. So if the CDC is kind of known for disease control, right, and prevention, CMS is known for actually Medicare and Medicaid and providing care to individuals and paying for that care. FDA approving drugs and approving medical devices and other food. Anyone know what NIH is kind of known for? National Institutes of Health?
Are they the ones who kind of make sure that the new procedures and things are okay? They're kind of like a review board for disease treatment?
Not completely, but in a way, I guess in a roundabout way, yes. You may be thinking of the FDA that will approve devices and or clear devices and drugs, but the NIH does have a role in that too. The NIH is mainly known for research, so they will fund. You'll hear often of NIH grants. So the U.S. government, which is funded by you and me, and all of our fellow citizens, we provide money to the NIH, and the NIH then gives research grants either in basic research to either certain institutions, usually academic institutions, but then they also provide research grants for medical research. So most cancers nowadays, the treatments are so quickly evolving that most patients are treated in clinical trials. And the NIH is frequently one of the contributors. Industry also contributes significantly to research. And when I say industry, I mean the medical device companies and the pharmaceutical companies also pay heavily so research trials can be done. So you can, one, determine that it's safe, first of all, and then second, that you can determine that treatment is actually effective. So NIH is kind of known as the government's research arm. And then there's one that's not on here, and it's fine, but I wanted to bring it up because it's becoming more important, mainly because the government is starting to enforce this certain law a little bit more, and this, I think, is Group 9. Have you all heard of HIPAA?
Yes.
Mm-hmm.
So HIPAA, and I don't want to steal their thunder, but I'll let them talk about HIPAA a little bit more. But one of the organizations that enforces HIPAA as it relates to privacy. Did you come across this group? It's OCR.
It sounds vaguely familiar.
Go back to the slide that Susie had that was the organizational structure. It might have been on there.
Sorry, I animated all of those.
Yeah, no problem. It's great. So let's see if OCR is on there. It doesn't look like OCR is on there. And just as a note, this slide is a little bit old. Do you see the third one down in the middle that says HCFA? HCFA?
Yes.
That's no longer existing. The name of that organization changed. Does anyone know what it changed to? Probably the biggest organization department in HHS now. Which one's not on there that I highlighted?
The NIH?
No, the O.
NIH is there on the right.
Oh. CMS.
CMS, that's exactly right. So HCFA, they changed their name quite a few years ago, so you might want to just try to get a more recent org chart, because that's CMS. But it's good that I'm actually glad that you're showing this, because it used to be known as HCFA, and some people who are in healthcare for a long time still kind of they just refer back to their old habits and they call it HCFA. It used to be known as the Healthcare Financing Administration, but now it's CMS, Centers for Medicare and Medicaid Services. So the OCR one that I was talking, it's there. It's on the far right, above Inspector General and below the General Counsel.
Oh, yeah.
They just didn't list the abbreviation
Yeah.
of OCR. So Office for Civil Rights, OCR, they're the ones who are responsible for enforcing the privacy portion of HIPAA. Now, HIPAA, you'll learn from Group 9, if I'm not mistaken, a lot of different rules and laws, and privacy is probably the biggest one. That's becoming a much more important division within HHS. And then the one under OCR is the Inspector General, and I think you had a slide on that. If you'd go to that one. This is kind of the enforcement, in healthcare. So when you hear of like healthcare fraud or billing fraud, or not, maybe it's not even fraud, maybe it's just abuse, meaning no one's trying to break the law, but the rules are very complex, and so people just kind of make mistakes, and that this department, it's often referred to as the OIG, the Office of the Inspector General, and the OIG. There's an OIG for many departments. The Department of Defense has an OIG. So OIG is a general term. And it's found within many departments. But when we refer to this OIG, we're talking about the HHS OIG. I've made my career in compliance, trying to keep hospitals and doctors and medical device companies from getting in trouble with the government. Because think of our tax law, for example. Let's leave healthcare for a second. How many of you do your own taxes?
Me.
Some of us do. Some of us might hire an accountant, or at least wish we had an accountant that could do all that for us, because the tax law is complex and it changes all the time. Well, guess what? The same authors of the tax code have all sorts of rules and laws for healthcare. The federal government has a way of piling up regulations and rules, and don't get me wrong, there's a lot of that's important. And we can get political and argue whether it's too much or too little. But as it stands today, it's a very complex situation. A hospital is going to get reimbursed for treating a Medicare patient. If you don't bill it correctly, you can end up paying severe fines and penalties. And the Office of the Inspector General is one of the main departments in charge of proactively going out and auditing, or reactively going out to audit if they get a whistleblower or a hotline complaint or those sorts of things. And I've been a compliance officer and have been in that field for 16 years. So hearing this gentleman speak at our national conferences, most people listen because he has a lot of influence on where is the federal government going to try to enforce any fraud or abuse type of issues. So again, you can have a whole career, and I've done it, on just this one little topic. And as Ross talked about CDC, and I mean, you can have a whole career in a lot of these different areas. So this was just meant to give you kind of a taste of some of these things. Let me see if anyone has any questions. You can either ask them in your microphone, or you can type them in the chat box.
So,
go ahead.
I was wondering, you made a comment that made me wonder if there's only one Inspector General, or if there are several offices of Inspector General throughout the branches of healthcare.
No, so there's one Inspector General for HHS.
Okay.
Federally.
So
and then
sorry.
There'll be an Inspector General in the Department of Defense, which is a different part of the cabinet, right? There'll be an Inspector General in the Department of the Treasury, or the Department of the Interior. Now, there's also Inspector Generals at the state level. So a lot of states will have, and tomorrow night the group will talk a little bit about how Medicare is more of a national program, and Medicaid is a mix between national and state run. And so a lot of states will have their own, because state dollars are at risk. A lot of states will employ their own Inspector General, and they usually focus on Medicaid. So you'll hear about Inspector Generals and the Office of the Inspector General. The only reason I made that comment is I wanted you to be aware, is you might hear it once, but it might be the Texas Medicaid Office of the Inspector General. So you just have to be aware of, well, which Inspector General.
So my group is presenting next week on EMTALA, and one of the ways EMTALA is enforced is through the Office of Inspector General. Yep. So is that this same person we're talking about here?
Yeah, so he's got a lot, yes.
Okay.
So it's one of the ways that EMTALA can be enforced.
I just was curious if it was the same person we were talking about when, next week we talk about the Office of Inspector General. Is it this man that we're talking about here?
Yeah, so he's the head of it, right? He's the head of the office. But as you can see, they've listed here, there's over 1,500 employees. It's a large agency. So he oversees the department, correct?
Okay.
Yeah, it's a good question. Okay. Other questions? While we're waiting for other questions, I'm going to ask each of the group members to maybe say one thing that they didn't know about HHS before. Just kind of want to hear what one thing surprised you the most to learn of, that you probably wouldn't have learned of if this hadn't have been your topic. But before you do that, I wanted to also mention you will get a question on one of the tests on this, and I say it every semester, and every semester somebody misses this question. and it's probably just because they didn't listen to the recording. But one of the questions you're going to be asked is, you just need to pay attention to the difference between the head of HHS, who is, if you could go to that slide, I think it was towards the beginning. Right, Secretary Sylvia Matthews Burwell. Before her, anyone know who it was before her? Former governor of Kansas. She resigned, and Sylvia Matthews Burwell became the secretary because the person before her resigned because there was a lot of controversy over a website that didn't work very well last year called healthcare.gov.
Yeah.
Was it Maria Cantwell?
Remember that? It was Kathleen Sebelius.
Oh, she's the one we're discussing this week.
Yeah, Kathleen Sebelius was the Secretary of State. I'm sorry, Secretary of HHS. Excuse me, Secretary of HHS before. But I wanted to point out there's a difference between who heads HHS, and if I asked you who heads up CMS, would that be the same person who heads up HHS?
Well, the CMS is under HHS,
Exactly.
so it would be, right?
Well, no, so just the question is very specific, and so you want to give a specific answer. So if it specifically asks you who is the head of HHS, that's Sylvia Matthews Burwell. If it asks you who is the head of CMS, they will give you the answer in tomorrow night's presentation. I just want to point that out because sometimes the question's asked and people are maybe seeing the S in there and they're just reading it too quickly and they heard of HHS and they get it confused with CMS. But whoever said that is right on the money. I wanted to point out that HHS is the parent organization and CMS is just one of those departments, right? Similarly, if you asked who heads up HHS, you wouldn't answer President Obama. Right?
Right.
He may be over all of it, but he's chosen a secretary who was confirmed by the Senate. So just listen for tomorrow's recording and just keep those two names in mind, and one heads up HHS and one heads up CMS. And then just read carefully when you take the tests. Great. So can we just maybe, with each group member, is there something that kind of stuck out to you that you were glad you learned, or learned that you wouldn't have known if you hadn't chosen this topic?
Yeah, I can go for it. I was really just surprised about how many people and areas were incorporated in the group. I didn't realize how big it really was, I guess, until I started researching it. So I thought that was pretty amazing.
Yes, that's a really good point. There aren't very many companies in the world that have that many employees, right? I mean, that's a lot of employees. So, yeah, good point. Anyone else?
Mine was similar to that. I had heard of a lot of the organizations, the FDA and the CMS, and just a bunch of those different organizations, but I had no idea they were all under HHS. I always just kind of thought of them as their own individual entities, which they are to an extent. They're specialized and compartmentalized so that it's better organized, but I didn't realize they were all part of the HHS, and that was interesting to me.
That's a great point. Before I started my current job, I worked for the University of Texas system, and a lot of you have probably heard of the University of Texas in Austin, the Longhorns. Some of you may have heard of the University of Texas at El Paso, which is a whole other university, or the University of Texas at Dallas. So all these different universities. There were 9 academic universities and 6 medical institutions, but they all were under one kind of parent board, the University of Texas Regents. And so you make a good point. A lot of these departments are so well known just as individual divisions or departments that we kind of forget that there is a structure. So thank you for sharing that. Ross or Sarah?
One thing that I thought was interesting, I always learned about the cabinet and how they're like advisors to the president, but I never really thought how like what kind of advisors they were and what they would advise the president on. So it's really interesting that that Sylvia Burwell, she is part of the cabinet, and that she's the one that advises the president concerning the health and welfare of the country.
Yeah, it's such a big part of our economy, right? That you'd hope you'd have some experts like this that can really dig down and know the details and try to apply, whoever the president is, right? They're going to have maybe principles that guide them, but they need detailed people as well to kind of implement what those guiding principles are for a president. And that's why each president usually chooses their own secretary. And so when the president changes, you'll probably see, it doesn't always happen, right? But usually the president will change the leadership in each of these departments. Ross, anything?
Then what happened to the secretary after that? Did they retire or something?
Yeah, they usually retire and they usually go on to become consultants and make lots of money.
Yeah, I wonder how they make currently. Geez.
So under Bush, you probably have, some of you have probably heard of, sorry, my mind just went blank. He was the governor of Utah. He became the secretary of HHS, and he also served as the secretary of the EPA, the Environmental Protection Agency. And now he's back here in Utah leading up a big consulting firm.
Oh.
Sorry, my mind just blanked on him. I can see his face in my mind's eye, but I'm trying to remember his name now.
Is it Huntsman?
No, it's not Huntsman. It was right before Huntsman. It was I'm gonna have to Google it. Ross, go ahead and tell us something, and then I'll come back with the answer.
I was really impressed with like they said, the size of the HHS and how it has so many different components that are all, a lot of them are well known in and of themselves, and a lot of them are huge and receiving a ton of money. But the HHS is neat because it links that structure like you were talking about, how it links it all the way to the president. He nominates his secretaries of this. So I thought that was really neat. Like the missing link in my mind between the heads of the government, like the smaller organizations that are also big.
Yeah, excellent point. HHS, outside of the Department of Defense, I don't think there's a single, and HHS might have already passed the Department of Defense. When you look at budget, I think one of you shared a slide of they have $1 trillion budget. It's hard for me to keep track of what their current budget is. So the Department of Defense might have a bigger budget, but they may not. This might be the single part of the cabinet with the single largest budget in the entire country. So think of that. You have these other departments like the Department of Education or the Department of the Interior. Not to say they're not important, but if you just look at budget dollars, this one dwarfs almost all of the others. So the person I was thinking of is Governor Leavitt.
Yeah.
Michael Leavitt. So I don't know if you know him, but he was the governor of Utah. Then he went under President Bush, the second President Bush, I believe, as his secretary of. He may have started as secretary of the EPA, Environmental Protection Agency, and then went to HHS, or it may have been the reverse. But anyway, he's now here back in Utah, and he has a consulting firm in healthcare. So they may move on to other things. They don't all do consulting, but it's a pretty high-profile role. So, well, I've taken enough of your time tonight. You guys have done an excellent job. If one of you would please post your slides, if you haven't already done that, on the group discussion board for this week, and then just kind of monitor that site to see if your classmates or anyone else has questions. Please try to answer those, and other than that, you guys did a great job. Thank you.
Thank you.
Thank you.
Have a great night.
You too.